Are you trying to make a baby? You and your partner trying to make a baby and it just isn't happening. And you went to a fertility clinic and they said, we're sorry, but you're going to need to do in vitro fertilization, IVF. And then you look into it and you find out that they want, 30,000, 40,000, and you're like, what? Why? And you're looking for another answer. Well, the reality is Mother Nature can be really hard on us, and we have to sometimes do our best to outsmart her. And I don't know why it's so expensive, IVF. I got into it and I'm trying to keep my costs down low, as low as I can go, but it's just expensive. And is it the doctors? Is it because the FDA has put so many rules and regulations? They do IVF on animals in the back of a pickup truck, cows, sheep, whatever, and it's a fraction of the cost. So I don't know, probably a combination of a bunch of things. So we try to keep the cost down here at Fertility Partnership. So along came this device, INVOcell, and I talk about it a lot because you haven't heard about it. Why haven't you heard about it? Because fertility clinics don't want to do it. Why not? Because the profit margin, I don't know. You don't make a lot of money doing INVOcell, but that doesn't seem to stop some of us who are using INVOcell. I think it's a great device. Basically, what is it? So I've been asked to talk about it. So INVOcell, it's like IVF in that we super ovulate you. We give you medicines you have to inject just like with regular IVF. And yes, the drugs are expensive. We tend to use less medications. Why? We don't want as many eggs to put inside here. We collect the eggs and then we take the sperm and we inject the sperm into the eggs unless we're asked not to for religious reasons. Yes, Catholic people who follow the rules will want the sperm and the egg to meet inside the body, and apparently the Vatican hasn't said no, haven't said yes, but then said no, so I guess some people are doing it. Otherwise, we inject the sperm directly into the egg, right? And then that gets put inside here, and then this goes where, and you walk around with it 5 days, and then we open up and we go, hey, look what we got, and then we can put an embryo in fresh. And we can even freeze we can freeze them all. We can even freeze them all, but we typically will put one in fresh if we can, if you haven't made too many eggs, haven't required too much meds. We could do biopsies on them before we freeze. So what do we lose? Very little. Some people will tell you that you lose the ability to find out fertilization. In other words, normally we put the sperm and the egg together, or we do ICSI, and then the next day in the lab we open up and we look and go, oh, there's a normal fertilization. Where's a normal fertilization? That's a normal fertilization right there, 2 pronuclei. 16 hours after we put the sperm in, that's what we expect. Can't see that if you do this. Is that a big deal? No. Why? Because on day 5, when we open it up, we look to see what we get. Let's say we put in 8 eggs, get 2 or 3 good-looking, day 5 blastocyst type, but we'll see the ones that stopped growing at this phase or this phase, and those that didn't fertilize. So we can make a proper diagnosis, which is important, especially for folks where we don't quite understand why they're not getting pregnant. It's important to gather as much detail so we can come up with a good plan. But INVOcell, it's for people who, number one, we just have to bypass the tubes, right? Somebody got snipped. No brainer, especially if they both had parents, both have children, both are parents. Then it's very useful for situations where people have to buy sperm, where they don't have their own sperm supply. Single women, same-sex couples, couples where the man is asospermic, has no sperm. This is great, because every vial of sperm costs thousands of dollars. And if it takes 4 or 5 times, this is a much more cost-effective device, program. Anyway, INVOcell, it is an excellent alternative to traditional IVF, and you really have all the same options. You could do genetic biopsies, you can do whatever. And how much does it cost? find out. 6 or 7 plus meds. Shh. Bye.